Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Kokar, Professor of Forensic Medicine and Toxicology. Have started the Thanatology, and this is the second lecture of this series. And the contents of today's talk will be that I'll be discussing how we diagnose somatic death. What is the criteria of diagnosis of somatic death? And what are the guidelines and principles which are required for certifying death? And these are basically the immediate physical signs, the physical signs which are appearing at the moment of death. They are basically the principle and the guidelines for certifying death. So, starting with the topic diagnosis of somatic death. What are the guideline principles for the diagnosis of somatic death? The first is the clinical interest should always be superior than the preservation of isolated cell as organ. That means when we are going to take the organ for transplantation, the clinical interest is superior. The first is the life of the person. The second is determination of death is to be based on clinical examination. Clinically, we should certify death. And the third is that during the transplantation surgery, death should be certified by two doctors who are not related with the transplantation team. The diagnosis and certification of death should be by independent doctors, two doctors who are not related to the transplantation team. Then the regarding diagnosis of death, doctors are often required. We know that during life, during clinical practice, doctors are often required to certify death. And in order to do this, the doctors rely on the signs of death, and they are basically the immediate signs, physical signs which are appearing at the moment of death. And these are the basis of diagnosis of death, and these physical signs, immediate signs, they appear at the time of death, at the moment of death. So, what are those immediate physical signs or which physical changes which appear in the dead body? Loss of tripod of life. That is, three integrated vital systems. Loss of that is the loss of tripod of life. Absence of brain function, loss of muscle tone, onset of muscle flaccidity, which is primary flaccidity, and these are basically due to the loss of innervation, loss of the central nervous system, loss of reflexes, and dropping of jaw, looseness of the limbs, and no response to external stimuli. These are the loss of reflexes due to loss of innervation. Then the second is the cessation for the criteria of cessation of circulation. And this is determined by palpation. We feel the pulses, the peripheral pulses, the radial, the carotid, and we feel the pulses. And sometimes this is not a reliable indicator because the heart may continue to contract feebly without producing a peripheral pulse. Then auscultation is reliable, and this method should be relied upon for detection of the absence of cardiac activity. And whole precordial area should be auscultated, and the auscultation must be performed carefully over the whole precordial area before it is decided that the cardiac activity is absent. Sometimes the heart sound may be so feeble because of the thick chest wall, like in emphysema, the heart being distant, and that sound can not be readily heard. So, much care should be taken during auscultation of the whole precordial area also. Then ECG will settle the issue because that pick up the electrical activity and that will solve the issue. Then the third is the cessation of respiration. So these three vital systems, the first we discuss the central nervous system, second we discuss the respiratory system, CVS, and the third is the respiratory system. Cessation of respiratory system is basically it may be detected by careful inspection of the chest and abdomen. Absence of air entry can be demonstrated by auscultation with stethoscope. And this auscultation should also include the larynx, area of the larynx. And there may be some other tests which were used previously and they are now the history because the invention of the stethoscope it resolved all the issues and those obsolete tests are not in use now, only we trust on the use of stethoscope. Then bilateral fixed pupils, that is when you throw light in the eyes the pupils will not constrict and they remain dilated and does not respond to this, that is called as fixed dilated pupil. That when we throw light into the eye it does not contract and that is the fixed dilatation of the pupil and this is present on both sides. And this is due to primary relaxation of the pupillary muscle due to loss of innervation. So, for the diagnosis of death, we have to establish brain death. And the death is declared when there is permanent fixed dilatation of the pupil, absence of all nerve reflexes, cessation of respiration without aided gadgets, cessation of cardiac activity, complete flat ECG. And if the heart sound and the respiration are absent over a continuous period of several minutes, death may be certified. So thank you very much. This is all about the second lecture. We'll continue in the third.